In only 2 days, you can move your career further, faster with the Harvard DCE Professional and Executive Development Program. Advance your leadership skills, craft smarter business strategies, build your network, and move your career in the right direction. You'll earn a certificate of completion, add Harvard to your CV, and become the leader you want to be. Our intensive programs are designed to fit into your busy schedule. Attend online or on the Harvard campus. Search Harvard Professional and Executive Development to learn more.
Well, hello there. I'm Nurse Mo, and this is the Straight A Nursing Podcast, where I teach concepts and share tips on how to thrive in school and at the bedside. And today, you're getting a ton of tips, not so much for me. I'm actually bringing in an expert speaker for you today, an expert mentor and coach for the CRNA career pathway. And that is Jenny Finnell from CRNA School Prep Academy. So before we jump into the interview with Jenny, I do want to take a quick minute so that I can give a listener a shout out. And this one goes out to Kate, who says this: I listen to your podcast religiously, and I constantly tell my peers about it. I feel lucky to have discovered it because you have helped me understand so many concepts so much better. I consider you my mentor from afar. Well, thank you, Kate, for taking the time to submit your feedback about the podcast and how you're using it to help you thrive in nursing school. And I'm 1000% thrilled to be your mentor from afar. So speaking of mentors, Jenny Finnell is absolutely amazing. She's a certified registered nurse anesthetist, or CRNA. She has done all kinds of really cool things in her career. She worked on an open heart surgery team. She worked in an outpatient surgery center. And now she works as a CRNA at a level 1 pediatric hospital. And as you'll hear from my conversation with her, she has a really deep passion and commitment for mentorship and basically, mentorship for the CRNA profession and getting nurses into that profession because she is just so passionate about it. So she runs the CRNA School Prep Academy, which is a mentoring program. And we'll talk about a little bit about that towards the end of the episode. What I want you to get out of this chat that I had with Jenny is that if you're even thinking a little bit about CRNA being in your future, there are things that you can start doing right now, even if you're not in nursing school yet, that will help set you up for success. So let's dive in to my chat with Jenny Finnell. So I'm here today with Jenny Finnell from CRNA School Prep Academy. Did I get that right, Jenny?
Got it right. Good job.
I got it right. Okay. Why don't you take a quick minute and introduce yourself? And then I've got a ton of great questions for you that I think my listeners will really be interested in if they're even thinking about being a CRNA. So tell us a quick bit about who you are and what you do.
Sure, I'd love to. So my name's Jenny Finnell, CRNA now going on 10 years, which is, oh my gosh, hard to believe. But I have always loved what I do. About 4 years ago, actually almost 5 years ago now, I started getting more active on social. People started reaching out to me and asking how I became a CRNA. And of course, naturally, I gave out my cell phone number and started mentoring. And I quickly realized that, wow, there's just not enough information. The pathways are also different. And so because I always had a passion for precepting and mentoring students in that realm, it was kind of natural for me to get into the mentoring space. So I started CRNA School Prep Academy 4 years ago, and it's kind of just been off to the races since then. We've now mentored over 5,000 ICU nurses, many of which have gone on successfully to gain acceptance in the CRNA school. And I have learned and grown so much. It's a huge passion of mine. I enjoyed the thrill of getting people into school and then sharing that acceptance with me. It's kind of like getting to relive that cloud 9 feeling. But yeah, I'm just here. I'm happy to share and all about becoming a CRNA and about this career path.
Okay, awesome. So I guess the first question that I have is whether you're a student or maybe you're a nurse, been working for a little bit, how do you know if this is the right career path? How do you know that you're suited for this path, that it's something that you would be good at, all of those things?
I love leading with this question, Mo, because this is definitely something that I think nursing students in particular kind of have a hard time understanding because, of course, what I remember anyways about being a CRNA from the very early days was in nursing school, people talk about career paths in nursing. And CRNA was like one of those high tier, like, oh my gosh, if you ever get lucky enough to become a CRNA, you've made it, and people kind of see it as like, the cream of the crop. But what I'm here to tell you is we all start where you start. But you don't want to head into this career path until you've really done a thorough investigation of what it actually means to be a CRNA. You don't want to invest that time and money into this career path because it takes a long time and it's quite expensive unless you really are sure this lights you up inside. And so really the best way to investigate what does it mean to be a CRNA and how do I know if it's the right fit for me and my personality type is to get into the operating room. This should start early on. You can be in high school. You can be a nursing student. Really, it's not too early to get these experiences to start understanding what would it be like if I was in these shoes? Would I be happy? Would I be comfortable being in the OR? The OR can be a very fast-paced, high-intense environment. You have to be, as a CRNA, you make independent decisions, which is part of the benefits of being a CRNA is you have a quote unquote what you'll Google, which is a lot of autonomy. But what does that mean to you? And how do you feel by having that responsibility? Because while it's a big responsibility, it's equally incredibly rewarding, but you don't want to take that lightly. So again, you're mixing drugs, you're determining how you're treating the blood pressure, blood fluid management, talking with the surgeons, the circulators, all of that. It's a lot of communication that goes on behind the scenes, even though the patient's asleep. And so seeing that firsthand and I remember being kind of in awe of what a CRNA did and being like, oh my gosh, I'll never be able to achieve that. They just seem to know everything. How do they know all that? But I would encourage you to take a deep breath and slow down and realize that they spent years training to get to that point. And so I would take multiple shadow experiences to kind of see, is this something that really lights me up? Do I get goosebumps? Do I get excited? Talking to a CRNA about what are the pros? What are the cons of being a CRNA? And let them tell you, well, the pros is you don't have to work night shift if you don't want to. The pros are you can have more time with family and holidays and weekends. But maybe a con is the fact that your breaks are unpredictable and you have to have a really good bladder control. So just things like that, kind of getting some insights on what it really means to live a day in the life of a CRNA is a really great place to start.
I love that. And I like that you talked a little bit about what a CRNA actually does, because if you've never been in an OR, you might just think that a CRNA just gives the gases, gives the meds to put the patient to sleep, and that's it. But there's so much more. So can you just briefly talk about like the different things that you do? I know as the CRNA, you're the surgeon's doing the surgery. You're keeping the patient alive, right?
Correct. You definitely have to be in tune with what you're doing, or what the surgeon is doing, I should say, and also what the patient needs based on that surgery. So I've done open heart, I've done pediatrics, I've done labor and delivery, so epidurals, spinals for C-sections, every different type of surgery you can imagine. CRNAs do all kinds of cases. There's nothing a CRNA cannot do in the realm of anesthesia. So with that regard, let's just say I'm doing a MAC, which that stands for monitored anesthesia care. In a nursing realm, it's kind of like Ahmad said, but more in depth. So that's kind of how I would look at it as, nurses call it Ahmad said, but in the anesthesia world, when it's more in depth, it's called a monitored anesthesia care. And those can technically be a general without an airways because you have to sometimes get the patient pretty sedated to tolerate some of these painful procedures under a MAC anesthetic. And then there's something, and that could be for like an AV fistula, for example. Those patients are really sick. They're usually getting dialysis and, the potassium can be out of whack. You have to really watch their fluids because you can't overload them with fluids. They tend to be dry and all on lisinopril, their vascular paths, their heart IV sticks, et cetera, et cetera. So those can be really challenging cases. A lot of them have, heart failure along with it and different comorbidities. And then you have things like open heart, where the patient's coming in who has an unstable coronary disease or maybe a valvular disease, and you're doing an open heart case. And those types of cases require a lot of communication, not only between you and the surgeon, but the perfusionist that's involved. You have to mix your own vasopressors. You have to know how to titrate them based on effect as far as the blood pressure management. You're running things like ABGs, which is an arterial blood gas. things like a TAG, which is looking at the coagulopathic nature of someone's blood components, and then knowing whether they need platelets or whether they need FFP to kind of stabilize them post-pump. So there's a lot that I think people don't realize that CRNAs do. It's so much fun. If you're excited, you're getting kind of nerded out right now, like this is definitely a career path that will light you up. It's a lot of pharmacology, pathophysiology, but yeah, they're all very different types of cases. But maybe you just want to do pediatrics. You can go work at a pediatric only hospital. Maybe you just want to do OB. You can go work at an OB only facility. Maybe you just want to do neuro. Well, you can work at a hospital and specialize in neuro and do a lot of neuro cases, which are things like craniotomies, laminectomies for back surgery, things of that nature. So there's a lot of subspecialties you can get into in the anesthesia space.
Wow. That I'm a little nerding out, but there's no way I'm going to CRNA school. It just sounds so intense. But if you'd caught me when I was at, about 3 years in to being an ICU nurse, I probably would have been all in for this because it is exactly the sort of stuff that I absolutely loved about critical care nursing. So thank you for making it sound so exciting and bringing that to life. So if you're listening to this and you got all excited when Jenny was talking about that, you might be starting to think, hey, maybe I could do this. So when is that ideal time to start preparing for this pathway?
Yes, this question is going to look different for every individual. So let me preference this with, I'm going to give you generic overall advice. However, you have to do your own assessment as far as what you need. You can't say everyone's going to fall into a certain category. However, what I see to be the most successful, meaning the students who tend to find the most success in their CRNA journey, are the students who start very early. And when I say early, the earlier the better. That's why I said if you're in high school, shadow now. If you're just decided nursing's your major, start now. If you were already going to graduate nursing school, start now. Essentially, the key point is start today, investigating if this is the career path. Don't wait, because unfortunately, the more you wait on planning and preparing for CRNA school, the more roadblocks you may face and the longer it's going to take. And potentially, when people face roadblocks, they tend to get discouraged. And sometimes they give up on their dream. And I have people say, well, CRNA seems so unattainable. So I went back and got my master's in as an FMP. And then they come back after doing all that additional work, only to go back to CRNA school because they couldn't let go of the desire to become a CRNA, when really they should have just doubled down and focused on what it took to become a CRNA from the very beginning and not went down that pathway of maybe it's not right for me, maybe I'll just do FMP instead. Just save yourself the trouble and the pain and focus in right now and start investigating if this is a career path. So really the answer is today. If this is interesting to you after you're done with this lecture or this podcast, to start doing some extra research today.
Okay, I love it. And then, so you talked a little bit about the education component, and I know there's a lot. This is probably a really big question, but if you could just give a high-level overview of what the educational background kind of looks like for someone who's going into a CRNA pursuit or heading down that path.
Yeah, no, that's a great question. And this definitely has a lot of different components to it, but I'll give you the basics. BSN obviously is pretty standard. Just having a 4-year BSN degree, definitely a one pathway. Another pathway would be to get your ADN and then go on to get your BSN. That is probably the most common pathway that I see today, mostly due to the fact that it's the most affordable pathway to become a nurse. You typically can get your ADN, and then you can work in the ICU, get your ICU experience while you're getting your ADN, or after you get your ADN, sorry. And then while you get your BSN, you can get your ICU experience under your belt. That's probably the most common pathway because it does make the most sense financially. So the last pathway is having a bachelor's in science of any kind, and then getting your ADN or your BSN on top of it. So BSN or ADN plus BSN or BS, bachelor's in science, and then your BSN on top of that. So those are the pathways that are the most common. Now, people maybe you're listening, you already have a master's degree. That's okay. I think a lot of confusion too when we became a doctorate degree. People thought you had to already have a master's to go into CRNA school, but that's not the case. You go directly from having a bachelor's to a doctorate degree, becoming a CRNA. So that kind of gives you a brief overview.
Wow. I didn't realize that. When did that change take effect?
It just officially started. Let's see. Last year was the first year every single school in the United States, well, every single school period, had to become an official DNP. So that way, by the time they graduate, they will all be DNP prepared. So that just happened in the last. Well, actually, it was at 2022. So I'm mistaken. It's already 2024. Wow.
I know. Where did it go?
2022. Mm-hmm.
And then, so did that lengthen the duration of the programs, I'm assuming?
It did by about 7 to 9 months, depending on the school. But I would say the majority is about 9 months extra. And that 9 months is just your D&P project. The anesthesia curriculum itself did not change. The clinicals did not change. The training did not change. The only thing that really got tacked onto your schooling is this D&P project, which is your doctoral thesis project that you spend 9 months preparing. So that's the biggest difference between what used to be what is.
All right. So CRNA school, is it 2 years, 3 years?
36 months. So exactly
I'm sorry,
3 years.
what?
36 months.
36 months. I thought you said 6 months. And I was like, wait a minute. How is that possible? Okay.
Oh my gosh. Everyone would line up the door.
So basically 3 years start to finish.
Correct.
Okay, and can people work while they're going to CRNA school?
That's a great question. And that definitely varies program to program. What I will say now that most programs are D&P prepared and they tacked on that additional 9 months, a lot of schools allow the nurses to work during that D&P portion of their schooling, but it really depends on whether your program's front-loaded or integrated. And what that means is if it's front-loaded, you start off with all your D&P project. And so because of that, all you do, you can tend to work more easily than if you also have an anesthesia curriculum built into it. If you start with your D&P and a mixture of CRNA curriculum and then start clinicals relatively soon, which is called an integrated program, you're going to be much harder. It's going to be harder to work because, again, you're going to be juggling a lot more on your plate at once. So it really depends on the structure of your program and knowing the structure of it. And then also knowing their rules. Some schools have a hard rule that absolutely not, you cannot work. Other schools say, okay, do what you can, but if you don't maintain your grades at X point, then you're out. And that's kind of the hard truth too. So knowing what you can handle, I would say the majority of people don't work more than like a shift a week or maybe 2 in the beginning and then cut it completely out the last 27 months of the program or so.
Wow. Okay. So it's definitely, you're all in if you're doing this. You're on.
Yeah, because between clinical and class, you're looking at a 50 to 60 hour week commitment, clinical class. So there's really no time left to work unless you can stay up, unless you don't need sleep.
Unless you don't need sleep. Yeah, which we all need our sleep. Okay, that is a great reminder. And I think really plays a role in people's decision if they can even go down this path, right? Because that's a huge factor. What about the GPA? I've seen you talk about this a lot of times that getting a 4.0 does not mean you're going to get into a CRNA program. Getting a 3.5 does not mean you're going to get rejected. So what are the requirements for a competitive GPA?
I love that. And yes, 100%. 4.0s get rejected all the time. But what I will say is that the higher GPA you have, the better odds you're going to get an interview, but you can still bomb that interview. So that's kind of where the 4.0 students can really face a lot of rejection is because their interview skills are lacking, which we get into later. But as far as the overall GPA picture, what I want to stress and hone in on the most is the fact that you can't just look at your overall GPA. You can't just say, okay, I have a 3.0 on my ADN and a 4.0 on my BSN. I'm good. I have a 3.5. It doesn't work that way. Depending on how many credits you took in your ADN, how many credits you took in your BSN, they will all factor in on your overall GPA. Plus, schools always break down your science GPA and your overall GPA. Some of them also look at the last 60 credits of your GPA. They want to see trends going up, not trends going down. So maybe if you start off kind of rocky in your college career, which many people do because we're 18, we're children, and we're learning how to do keg stands, right? So, naturally, sometimes you just make some mistakes. They get that. They know you're human. But what they want to see is did you trend up and to the right? Not rocky all over throughout your college career, or maybe later in your college career, did you tank your grades? Because that'll kind of signify, how well are you at handling stress management? What are your priorities? And the longer you have with that not happening in your college transcript history, the better. So that's why they break down the last 60 credits. But science GPA are things like hard science. These are things like anatomy, pathophysiology, chemistry, microbiology. If you took algebra or statistics, physics, anything that's a hard science that doesn't have an NURS for nursing that happened outside the College of Nursing, those are hard sciences. So math, bio, chem, anatomy, again, these are core sciences. They add up that GPA alone. That is so important because that's a good indication of how successful they feel like you're going to be academically with the rigorous science-based curriculum that you're going to endure during anesthesia school. So if you have a science GPA that's less than, I'd say, a 3.3, that's going to set up some red flags. Why? Because most CRNA schools require an 84 to sometimes 87% to pass a class. B- is failing in CRNA school. So they want to see at minimum a B or better, ideally an A, B average, so like a 3.5 science GPA. And with how competitive things are going, I hate to be the bearer of bad news, but that keeps going up. So the average used to be a 3.5 science GPA. It's getting closer to 3.6, even 3.7. Some schools are getting, because they have so many applications pouring in their doors. And I'm not saying this to discourage you. Ultimately, I'm just telling you this, just don't stand still. Don't assume you're going to be okay and do nothing, because that's a good way to essentially have the door shut in your face. Take an advanced pathophysiology class, a graduate level pathophysiology, get an A and say, see, I might have a 3.3 in my science GPA from 10 years ago, but look, I took a graduate level science and I got an A. That's a good indication you were ready. It's kind of what I want to drive home. But overall GPA, you're looking at an average of 3.5. Science GPA, you're looking at a 3.5. But to be competitive, you're looking at probably closer to 3.7.
Okay, that's good to know.
Doesn't mean that you can't get a lower GPA and get accepted, but that's kind of where we're at today.
Yeah. And that's another reason to start today. If you're thinking about pursuing this in the future, starting today, really buckling down on those hard science classes, which I know a lot of students like heading into nursing school, they just want to be nurses so much. And they sometimes view these science classes, these prerequisites as, oh, I got to take this class before I can even apply. They almost look at it as a roadblock, but it's not. It is how you prepare and get that background core science knowledge. And it's also kind of how you show that you can handle the academic rigor of nursing school. And then further on, if you decide to go on to something like CRNA school. So start today, doubling down on those hard core science classes.
100%. Don't close your doors for later. You never know. I hear so many people say this to me, which is so upsetting to hear over and over like a broken record. But they said, if I only knew that, I thought nursing was it for me. I thought I'd be done. I thought I'd get that degree and that's all I ever wanted to do. 10, 15 years on the road, they're like, have a change of heart. And now they're kind of stuck with this track record of being, a C, D student. And it's so hard to climb out of that hole. Don't do that to yourself. If this is catching you before mistakes are made, it's so much easier to act now than to play catch up.
Yeah, absolutely. Absolutely. Okay. So let's say I've graduated from nursing school and I'm thinking about, I want to be a CRNA. I don't think I can just go apply. I think I need some very specific type of work experience. Can you talk about that?
Yeah, sure. This is another topic where people can get a little confused, a little misguided. What I want to stress and go home with a big tip for you, put all my words there, but is to reach out to your CRNA schools early and often, because knowing that all schools are the same, but they're also different. You have to understand what your school requires. Some schools will say, okay, the NICU is okay, but some schools don't. So you can't just reach out to one CRNA school and assume that applies to all CRNA schools. I know that's probably not what you want to hear, and it makes it confusing and sticky, but that's just where we're at. And that's why I'm here to kind of shed some light on what ICU units count. Units I just want to right off the bat eliminate, because I don't know why people even think this is ICU, but I want to eliminate it now. PACU is not ICU. Operating room is not ICU. Cath lab is not ICU. For some odd reason, these are three units that people, I don't know how or why, but sometimes they just get thrown in the mixture of ICU. Maybe because post-surgery, you're taking care of intubated patients on occasion, but usually those intubated patients go straight to the ICU. If they don't have a bed on occasion, or maybe you have to intubate in the PACU, that does happen, but it's not an ICU. You're not doing long-term management of a sick patient in the PACU. Same thing with the operating room. I mean, you're not doing the management. The CRNA actually is the one doing all the management in the operating room. Your CRNA is delegating to, and you're getting to see close quarters with the CRNA to understand what the profession's all about. But you yourself as a operating room nurse are not actually managing that patient in a critical condition. And so operating room doesn't count. And then cath lab. Cath lab patients can be very sick, right? They have acute MI. They're coming in, they're unstable. And I get it. They're on drips and things of that nature. But that's still not long-term management. It's very usually short-lived. And again, you're going to have a CRNA in the room managing it with you for some of those cases. Some of them you don't, and they're more stable ones. So again, you're not the primary nurse taking care of that patient, especially if the CRNA is in the room doing some of it, and you're not managing it long-term, meaning they come in and out after a few hours. That's not long-term. Same with ER. But we're going to get to ER because ER is kind of a unique breed. So I'll come back to ER. But that being said, we're looking at ICU units such as the CVICU, any version of that, CCU, CTICU. I mean, just any version of a cardiovascular ICU. Same with surgical, neuro, trauma. Sometimes it's all combined. Sometimes it's specialized and separate. Any type of surgical trauma ICU works. Medical ICU works. All those are really safe. And they're all adult. Notice I've talked about mostly adult ICUs, because when you start getting to the kid realm, And I'm a peds CRNA. I love kids. And I'm not trying to tell you this to discourage you from becoming a NICU or PICU nurse, because I love taking care of kids and we need more pediatric CRNAs. But the safest bet is to stick to an adult ICU, because some schools can see, especially the NICU, as too specialized and not a well-rounded picture of what you will really be managing on a day in, day out basis as a CRNA. And you kind of really do lack the knowledge base of what the pathophysiology process and disease processes, pharmacology process of what a truly sick ICU patient in an adult world is like. And so the NICU is very few schools accept NICU, which is the neonatal ICU. And then you have the PICU, which is the pediatric ICU. That is more acceptable, meaning more schools will accept that. And actually, kudos to you guys if you're already on that track, because those tend to, like, statistically, they look at data. All CRNA schools look at data. And PICU nurses tend to score the highest on their boards and do really well overall. And we kind of have an idea of why that is. It's because you're really well-rounded. PICU can be, a toddler. They can be a 16-year-old. And, a 16-year-old can be an adult size, right? And then you have a toddler who's 2. So you have to understand a wide range of fluid management, doses per kilo. You're very skilled at doses per kilo. And so again, you tend to have a nice realm of management skills. The only thing you don't see, which is very unique to the adult world, are things like chronic comorbidities, like renal. I mean, you can't have a renal failure. You can't have a kid go into renal failure, but if they overdosed on Tylenol or NSAIDs, things of that nature. So it can happen, but you kind of miss out on some of the comorbidities that an older adult will have, but you can still get a really well-rounded experience as a PICU nurse, as long as it's a very high acuity unit. But overall, the safest bet is an adult ICU. ER, same thing with the whole PACU, OR, cath labs experience. The reason why they don't like ER is because it's not long-term management. Some schools will take it, not very many, like a small handful. On one hand, I can count how many say, yes, I take ER, no questions asked. The majority of schools who say ER on their website will say on an individual basis. What does that mean? It means it's not preferred. If you ever see individual basis, it means it's not preferred. So why would you do that? Same thing with the CRNA school says, I recommend this. Don't read into recommendation as maybe I don't have to do it. You should read recommendation as I need to do it and then some. So train your brain to see that recommendation as I need to do that and then some.
Okay, that is a great tip. Let's take a quick break. And then when we come back, we'll talk about the acuity that is needed for those ICU units. You mentioned a little bit about acuity. So I'm assuming you mean that not all ICUs are created equal. Can you talk a little bit about the acuity?
Yeah, sure. Because this is another one. People assume you have to come from a level 1 ICU, and you do not. However, the reason why that is such a well-known fact is because without a question, if a program looks at a resume and they see level 1 trauma ICU and it is ranked as a level 1, they know for a fact the acuity is there. They don't have to question it. Level 2, same thing. Level 2 is just as high of acuity as the level 1. The only difference between a level 1, level 2 hospital is usually a level 2 hospital it's not usually academic, and they don't usually do as much research. They don't get the status of a level 1 because they don't have the research behind it. But the acuity is high in both. So level 1, level 2, cool. Now, when you get to like the ones that are not ranked or the rural community hospitals, then it's okay to do that, but you have to really highlight your experience and show them that you took care of ventilators, advanced life support like ECMO or CRRT. And the reality is most rural hospitals will ship those patients out if they get that sick. If your patient's talking to you and swallowing pills, they're not sick enough. So you need to head to if your patient gets sick and they transfer them out, get in your car and follow the ambulance and apply for a job, whatever hospital they took that patient to. That's what I recommend, because if you think about it, most of these CRNA schools are in city hubs, and they have plenty of applications pouring in from all these high-level acuity hospitals. And even though I have some people say, but I live so far away from that hospital. But if you're willing to drive to CRNA school, that's an hour away, you should also be willing to work in the ICU that's an hour away to get that experience that's going to set you up for success. And that's what a program will tell you. So,
okay, I love it. Okay, so that's a good distinction. When I worked in the ICU, we were the receiving hospital for all the little, the smaller towns outside. And so I don't think we weren't a level 1 because we aren't an academic hospital like UCSF. That's a level 1 type facility. I would say it was a level 2 medical ICU. So good to know that would have counted had I decided to do this if I had met you many years ago, Jenny.
Sorry, missed the boat.
All right. So let's talk a little bit about standing out as an applicant And you mentioned earlier interviews. So can we kind of talk a little bit about standing out as an applicant? And you mentioned that sometimes the interview is what gets people to not get accepted. So a little bit about those things.
Yeah, this is a really hard question. And the way I visualize it in my own brain is you see, and this is just me because maybe I'm weird, but I picture applicants all a bunch of apples, right? And, if you're all a bunch of apples, you kind of look the same. You're all red apples. But what makes you the shiniest apple? That's kind of what you're going for. You're all going to have ICU experience, great resumes, good recommendations. And I've had plenty of faculty tell me it is incredibly hard because on paper, everyone looks the same.
Yeah.
So how do you differentiate yourself, especially before you even get an interview? Like I spoke to before, grades is a huge one as far as don't just stand still, take an extra course, show initiative. You don't have to be a 4.0 student to take an extra course, but if you think your science GPA is on the lower end, take an extra course. I'm not here to encourage you to just sign up willy-nilly for courses, so please don't do that. That could be a huge waste of time and money. So before you take anything, please understand whether you actually need to reach out to your programs, go to open houses, get involved. But that's kind of step number one. To stand out, get to know your schools. Go to their open houses. Most schools have them. And if they don't, go to some other school's open house. It's okay. Faculty know each other. They all talk. So even if you're like, oh, my school doesn't have an open house, which is not very many of them, but I know on occasion there's a few that don't, which I find really odd. But go to an open house that you can go to, even if it's a virtual one. Ask pertinent questions. And this is a time where they're going to give you, they're going to tell you the layout of their program. And I encourage you to go to several of those. That's step number one. And the reason why I think that's important to stand out is because you're going to have more information, and knowledge is power to allow you to stand out. So you have to inform yourself first and foremost. Number two is don't treat every application the same. It's like, I see students all the time say, I'll write one essay letter and I'll just throw it at all these schools. No. Number one, they all might have different prompts, and that would be A, not following the directions, which is an automatic elimination. So I don't care how good you look on paper. If you don't follow the directions or the rules and you have an essay that is asked for 500 words and you give them 1,000, boom, you're out. Like game over. They don't want people who can't follow directions. So little things like that go a long way. But ultimately, leadership roles are big. Doing things outside of the day-to-day, to-be expected stuff. And a lot of mistake people make with leadership roles is they join clubs and committees, but they don't do anything. They don't do anything. And that's not going to help you. Because if they ask you about that experience, you're going to be like, yeah, I'm on this unit committee and it's cool.
Yeah.
Okay, well, that's not, very insightful as far as what are you doing on that unit committee? What are you passionate about? And pick things that light you up. You don't have to. Sometimes people think they pick things that I'm going to go work for the Red Cross and volunteer for them because it's medical. But maybe that's not really what they're passionate about. And they can't speak to that very passionately. But maybe I met a student who loved the garden. And so she gardened and she gave all the food to a local food bank. She was so passionate about it. She lit up every time she would talk about it. I'm like, that's great. Own that. That's a passion of yours. They're going to see that. And that's going to make you unique. You want to stand out. And if you're not passionate about what you can speak to, you're not going to stand out. So when you're looking at leadership roles, pick things that really light you up, that you're really passionate about, and have a why behind why you choose to do something, get involved, be active. Those are my big key takeaways. And then the second one that you led into was the interview process. Oh, if I had a nickel for every time someone said, but I didn't think I'd get an interview, so they didn't start preparing. Oh my gosh, why would you do that to yourself? You are like literally putting yourself and walking into a Shark Tank and without any gear. And that's probably the best way I could kind of describe it. You need to prepare from the time you decide CRNA is a career path you want to do. Very, very moment. Meaning when you're in nursing school, whatever, that's when you start preparing for the interview. And that sounds crazy, but I'm not like I'm going to study for the interview. But the reason why I need to paint this overall long picture is because, first of all, when you learn, it takes time. You don't learn anything by cramming. That's a memory. That's a memory function. And memory only gets you so far. If you really want to understand concepts and connect the dots and create little pathways in your brain that allow really good recall, you have to understand. You have to know how concepts connect. That's building your roadmap to success, right? So that starts from day one. That means when you're in the ICU and you're shadowing, or when you're in the operating room, you're shadowing, you're asking why. Why would you, maybe not while they're doing it, but maybe if you have a lunch break with the CRNA, say, why did you pick fentanyl over Dilaudid? Why did you choose etomidate over propofol? Why did you choose a rapid intubation over a regular induction? Let them educate you on why they chose certain things to do. build your knowledge base and understanding of why these things were chosen. Like, be a toddler, ask why. And when you're in the ICU, same thing. Why is this insulin protocol this way? Why does this make sense? What's going on with this ketoacidosis? Why do they require this? How does it move the potassium in and out of the cell? What does it do to the calcium? What does it do? Ask yourself, how do these things play out in real life? And what kind of hemodynamics do you then see on the monitor? Understanding the why and kind of how it contributes to the disease process you're currently managing, whether you have a GI bleed. I mean, I remember Googling octreotide and then figuring out the mechanism of action of octreotide and creating my little binder, my little study binder. But just when you have drips you've never seen before, look it up. That's the best way to prepare for your interview, because that way it's not happening the month before, the week before, and you're like, what am I going to do? I'm going to try to find every CRNA question posted on Google and just study those and I'll be okay.
Oh boy.
I know. So set yourself for long-term success. And also why I like this method of preparing from day one is because it's going to help you be a stronger student in CRNA school and have a higher likelihood of success to graduate, right? All this knowledge you're learning in the ICU are all pieces of tidbits of knowledge you're going to then use in your curriculum in CRNA school. So if you have a strong background in pathophysiology and pharmacology coming into your CRNA program because you studied essentially all along the way, you're going to be so much further down the road and struggle a lot less. And you'll hear people say CRNA school is like drinking from a fire hose. It really is. I hate to say that's the one thing I can say is really true. The knowledge itself is not that it's difficult because it's a lot of similar concepts, but you take that one concept and you go way deep. And it comes at you faster than you can even concept that you're having to learn it. It's learning by rapid fire. And so it's hard to keep up if you get behind.
Right. Absolutely. Okay. Those were fabulous tips. And I love that you had a study binder. That's the sort of thing I would do, Jenny.
Totally nerd. I'm a nerd.
Okay. If you had to give like the key to getting accepted into a CRNA program, what would that be?
Oh man, just one thing?
Well, you could have a few. I'll let you have a few.
Okay. If I had to pick one thing, it would probably be to be well-rounded, because I've heard over and over again from a lot of program faculty that they look for the right person for the cohort. They don't just look for the book smart student. They don't just look for someone who can answer all their questions well or write a good essay, although those things are all important. They want someone who kind of has it all, which I know you're probably like, oh, that feels really defeating, but let me just back it up with the fact that if you kind of take some of the tips we gave you in today's episode, you're going to have it all. And I also think of this in my brain when I visualize what it looks like to be a well-rounded applicant is a bunch of polka dots. And you can picture your resume and your application like a bunch of polka dots, because you're going to have all these requirements. You don't want a giant red dot right in the center and barely any other dots around it. You want like a smaller red dot with a bunch of other relatively similar sized dots around it. So I have people go all in on certifications, meaning alphabet soup. I have every CMC, CSC, CT, I mean, all kinds of stuff. And it's like, oh my gosh, but yet their GPA is lackluster. That's not going to do you any good. Put more effort into boosting your GPA. Take courses you didn't do well in. People are like, oh, I'll just retake an old old microbiology course because I got an A in it the first time. I'll get an A in it again and it'll look good. No. But if you have a C in chemistry, they want to see, how did you improve in chemistry? That's your sore point. Retake that course. So look for your weaknesses. Look for the dots, all that, as I call it, that are small and kind of weak, and build them up to make your overall picture of you being a very equal, scattered out polka dot picture. So you're well-rounded, you're well blended. And lastly, with that comes emotional intelligence. Schools are focusing heavy on this today. And I could probably go on a whole episode on just that alone, but to summarize what emotional intelligence is, it's really self-awareness and also how you understand others perceive you. And so things like body language, eye contact, just how you speak and how you communicate, how you listen, how you take direction. Do you get angry? Do you get frazzled easy? These are all things. And trust me, as you age, you tend to, at least if you're become aware of yourself, you can grow your EQ, your emotional intelligence. But it really starts with awareness, meaning you can't grow your EQ if you're just completely oblivious to how others see you and how you are interpreted. So kind of the best way to start with EQ is to ask someone that really knows you well and say, what can I improve upon? Where do you see my weaknesses as a person? Do I avoid conflict? I mean, that's one of my weaknesses. Yeah, exactly. And are you a people pleaser? And why is that? Don't just say, okay, I'm a people pleaser. That's it. That's all I can do. What are you doing about that? Taking initiative to say, how can I improve? How can I actually, why do I not like conflict? And how can I put myself in conflict on purpose so I can figure out how to handle it better? So I can figure out why it bothers me and figure out a process that works for me that feels good. That way, if I'm in the OR and the surgeon chews me out because I didn't do something, even though it was maybe not even my fault, you can handle that situation with calmness and grace and make it so the surgeon's like, I'm going to invite you back in my room next time. You're like, oh, no, please no. But, ultimately, it's kind of like one of those situations where you've won if you deal with a situation that most people can't handle. And, you've allowed yourself to handle it to where they actually put you in those positions more often. So think about it as like in the ICU, taking the more critically sick patients. That's really high stress. But if you volunteer yourself to do those things, even though it's hard and it feels really scary, you will stretch yourself. So I think stretching yourself is really key with that.
Okay. I love that. Thank you for sharing that. And then I want to talk a little bit about this guide that you've made. And we're going to put a link in the episode notes to this awesome guide that Jenny has made and made it available for free to everyone. Can you talk really briefly about what that is? And then, again, look in the episode notes to get that link. So what's this guide all about, Jenny?
Yeah, no, I created this. Actually, it's funny. I just revamped it. So it's brand new and fresh for you guys. It's now 29 pages. It went from 21 to 29.
Well, I read it and I thought it was absolutely stellar.
Awesome. Well, thank you. Yeah, I've been working on it from the beginning, back when I first started mentoring 4 years ago. And essentially my whole point with making it is to really help you not have these knowledge barriers that are really going to hinder your process, your progress towards becoming a CRNA. I want you to be successful, whatever it takes. And really, knowledge is power. Like I said, the more you know now, the more you can take action today and allow yourself an easier path down the road. And that's what I want for you. I don't want you to struggle. I don't want you to feel like you're not capable. I want to empower you to feel like you can do this. And so the guide, my hope with it is to empower you to feel like you can tackle this dream. This is really what you want. I want you to have all the knowledge you possibly can need to take those active steps towards success.
Fantastic. And then tell people a little bit about the CRNA School Prep Academy. So for anyone listening who is actually actively starting down this path, guess what? Jenny you heard from her. She's awesome. Clearly, she can actually mentor you through this. So tell us about your academy.
Yeah, no, I'd love to. So CSBA, people call it CSBA because what a mouthful is CRNA School Prep Academy. But yeah, CSBA essentially, there's different membership levels. So we have what we call a foundations member, which are really for those who are just starting the planning process and really are just looking for some quick tools to allow them to plan for this career path, to know what next actions are. So if you're really early on in nursing school or even just exploring this career path and not even sure yet if it's for you, that's kind of the foundations membership that I would recommend. And then the premium membership is really when someone's like, okay, I know this is what I want to do. I want to commit, meaning even if you're in nursing school, if you're committing to becoming a CRNA, if you know 110%, that CRNA is what you want to do, no questions about it. The premium membership is really built not only to help you prepare for all the phases of your CRNA journey, but it's going to help you build that critical care knowledge base. We have a growing critical care library. We do a lot of education, and not just education. We actually take it directly from a CRNA curriculum. So we have CRNA faculty who do a lot of the education. So we teach you deep level pathophysiology, pharmacology, so much so that it's going to be the second time you see it is going to be in CRNA school. So it's going to be very in-depth. It's going to really help build those pathways like I spoke to when you're in the ICU and kind of connecting the dots. And it's going to allow you to interview more smoothly, transition to your role as a nurse anesthesia resident more smoothly. So again, we really give you the foundations and building blocks. We also do, in the premium membership, we do one live event a month. That could be a financial webinar on how to pay for CRNA school by a financial planner, a certified financial planner. That could be a group mock interview session. That could be a live resume edit. That could be a lecture on top drawer meds where we break down pharmacology topics. So we kind of mix up the live events every month. We also host virtual events with our national association, which is the AANA. I highly encourage you to know what the AANA is if CRNA is the career path for you. So we do things like that. And then we have, lastly, our guarantee program. Our guarantee program, it's been around for a year now officially. We've had a lot of success with it. We led our first cohort back in January of 2023, and we just graduated the first cohort, and we had a 100% success rate. And essentially, if we have an outline curriculum, that it's a 12-month curriculum that we outline what you need to do week by week. It's very, very detailed. And so we outline the steps of success. We've studied success now for 4 years, so we know what it takes to be successful. So we outline that. Then we also have faculty coaches. So we have CRNA faculty who have had program director experience, assistant program director experience, and they coach a couple times a week. You can go to these sessions and they coach you on specific topics. And that in itself is incredibly valuable and a way for you to, again, get past these roadblocks if you have them. So that is our guarantee program. And essentially what that means is if you don't achieve success, if you apply to CRNA school between 12 and 18 months and you get rejected, we get your money back for the investment in the program. So that's essentially what it means. It's a money back guarantee that, we trust our process so much that we want to extend that money back guarantee for our students.
That is awesome. That is great. Yeah, I don't think you had that when we talked last time.
No, it's new. And, I'm excited. And I honestly, it was one of those things where I'm like, I want to do this because I know it's what people want. Often people are like, Jenny, what I want the most is I just want to get into CRNA school. Just get me into CRNA school. And then, people don't like risk, right? If you invest all this time and money to pursue a career path and you're not successful, it kind of feels like, well, what did I just do with 2 years of my life or a year of my life? And so this was a way for us to say, okay, let's take a deep breath. Let's trust the process and go out and see if this can work. And it did. It worked. And so I'm thrilled and these students are thrilled. And it's a fun way it just goes to show the power of mentorship. And gosh, if you just have someone kind of help you along, it allows you to get where you want to go faster and easier. So that's kind of what we are. We're a mentorship program that believes in you and believes in your ability to achieve success.
I love it. Fantastic. Well, I want to thank you for coming on to the show today and sharing your wonderful knowledge. And you were very inspiring. And I just know that there are some people out there that are now thinking, actually, I can do this. So I want to thank you for that.
Well, thank you so much, Mel. It's been a pleasure as always.
So there you have it. I hope you enjoyed hearing from Jenny as much as I did. I really enjoyed her no-nonsense approach to this is how you get into CRNA school. She is just an excellent mentor and an excellent coach. So if you're thinking about this career path, and I hope that some of you are, because it sounds like a really amazing opportunity and a way to really grow as a nurse, take Jenny's advice, start working on the things that are going to make you stand out now so that you can bring your best self forward when it's time to apply for CRNA school. So again, in the episode notes, there's a link to that guide that Jenny has available for you. It's absolutely free. It's packed full of great information and great tips to get you started. And then, of course, if you want to take it further, signing up for her academy is obviously going to be a really smart move. So I hope to see you back here next week. I think we're going to be talking about a component of pulmonary embolism. I need to actually do the research for this episode. I haven't done it yet. But if all goes according to plan, we'll be talking about how a pulmonary embolism causes hypotension in next week's episode. And that would be great practice for someone who's thinking about becoming a CRNA, because we're looking at things like cardiac output, hemodynamics, blood pressure, all of that. So I will see you back here next week for that. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.